Oh, times like this, I wish I were Paul Harvey and I could pull off a page two and get away with it. But some of you may not even know who Paul Harvey is, but you have to be a really good, probably a little older radio listener. Uh, he's a news reporter that was kind of everywhere in the United States years ago, and he would move on from his stories, page two, page three, and that kind of thing. Anyway, enough of that. This is part two, if not page two of the fourth chapter. This is again reviewing more information about the psychological person. And in this particular section, we look at definitions of the self, take a look at relationships we have with others and how they're conceived, as well as the notion of stress, coping, and adaptation. All sorts of fields of thought really kind of struggle to define what the self means. Whether it be psychology or sociology or social work or even other kind of more esoteric fields such as theology and philosophy. And the chapter opens, or this particular section rather, of the chapter opens with some definitions about how we can maybe define the self, the essence of the self, with all this different range of perspectives. The self as a soul or a flow of experience, which sounds very philosophical and theological in many respects, or a creature of unfolding potential, or one who actively organizes and intervenes in the environment, one who has a cognitive structure that really makes that person a definer of reality, or is the self the result of shared symbolic experiences, a creature that is defined through our perceptions of how others perceive us, as Cooley would suggest. I mean, there's a number of different ways to look at what the self involves. And so when we talk about the self in relationships, it probably just isn't really a simple concept, at least from a philosophical standpoint. One thing is common among all these perceptions, I think, and it's something to keep in mind, is there's some really, really very Western kinds of ideas here, because these perspectives assume the primacy and importance of an independent self, or even the existence of an independent self itself. But there are cultures in the world that really see the self as an interdependent being that can't be detached from the context of its human relationships. We have cultures in the world that really focus upon the individualistic approach to life, who raise their kids to be successful individuals and move away from the family. And then we have those collectivist cultures that raise their children to really be a member of a community and a member of the family, and really emphasizes the interrelationships among family members, even as that young person becomes an adult and grows on in life. So in any event, the Western idea, this American idea of the independent self, is not universal by any means. But in any event, looking at it from our perspective, as we will, I think there are a lot of different theories that address how we exist in the context of our relationships. Relational theory is one that looks at the fact that people tend to seek relationships with other people, and that implies that we structure our personalities through our interactions with other people in the social environment, sometimes in order to please other people or in response to other people. That we learn our behaviors, our patterns of behaviors, through the give and take of our relationships, and that we really shape our behaviors to elicit care from other people, and also to enable us to provide care for others as well. So empathy becomes very important in this concept, and so does mutuality here. This idea that in a worker client relationship, for instance, that the relationship is a give and a take, and it's back and forth. In a relational theory, if this focus upon the relationship, sort of got a gestalt kind of a here and now kind of a focus, on how I'm affecting you and how you're affecting me. And one of the things that's very important in this particular type of approach, and I think is one of those hallmarks in social work, in our theory, in our relationships with our clients, is the notion of authenticity, that we be genuine in our interactions with others. And this also talks about the strategic use of self. Now, there's a lot of debate about how much of the self do you share with your client, and there are those who are of the very firm opinion that we don't share ourselves with our client, that this is something that is separate from the therapeutic relationship, and that we keep a very solid boundary between our personal lives and the client's lives. There are other beliefs and philosophies that, particularly when the worker is interacting with a client on an authentic basis, that they do share parts of themselves as strategic moments and things like this, and that of course is done with respect for appropriate boundaries. Again, that's a much more complicated kind of a concept. It's not something that we can address in the context of this particular lecture, but it is something that is definitely something you want to work on and understanding as you continue to develop in your ability to be a professional provider in the social work field. Attachment theory also has some things to say about how the self develops in relationships. Attachment theory really looks at early childhood and the kind of the nature, the quality of our relationships with our caregivers, primarily the very important, significant others in childhood, and attachment theory implies or suggests that children develop attachment styles in response to the types of parenting that they have encountered as children. So here are four different types of qualities of attachment, I guess, or styles of attachment that are said to be developed in early childhood. And the important thing about this is that these styles that are established in early life oftentimes, and really probably will likely be reflected in the person's attachment style as an adult, and it's going to impact relationships later in life. So obviously the child with secure attachment, this is a child who can separate from the parent when the parent's away and not experience an undue amount of anxiety or anything like this, but then happily reattach when that parent returns. This child, if this is the style of relationships that is established in early childhood and can continue into adulthood, is obviously going to be easier to be in a relationship with, and is going to find relationships to be more satisfying. Whereas the anxious, ambivalent child in adulthood may wind up being one who is prone to jealousy and guilt-inducing behaviors and a lot of anxiety and fears in relationships, and be much more difficult to manage in an adult relationship. And mind you, those relationships also can be transferred on as parents onto their children as well. Now, research says that attachment styles play a critical role in shaping the systems that underlie our reactivity to stressful situations. In other words, those of us that grow up in secure attachments are going to be able to deal with challenges and conflicts and stress in a more secure and confident manner. Persistent stress, there's been a lot of studies that suggest that a lot of stress in infancy and toddler years has an impact upon the development of the brain, and can result in the overdevelopment of areas of the brain that really are connected to that fight or flight kind of center, the anxiety and fear. And as a result, other parts of the brain, the cortex in particular, become underdeveloped. Now, this is important. For instance, if you ever have an opportunity to listen to Linda Chamberlain, she's an expert on brain development, childhood brain development, who's stationed in Homer, and believe me, she's a national expert. In fact, she's lectured and produced videos and things for organizations and agencies all around the nation. But she really is a true expert, and is a real local treasure if you ever get a chance to sit down on a training session of hers. And she'll tell you, she's done a lot of studies with children who grow up in domestic violence situations, and we know that observing domestic violence is harmful to children. But maybe what we don't know, and what she has learned through some of her studies of PET scans of different things of the brains of infants, that even an infant in the crib in the next room or two rooms away is impacted physiologically by repeated exposure to arguments and stress and violence in a home. And so, even if that infant is not in the room and is not involved in the argument, or the physical violence or anything like this, there's still a physical response to that infant. And so this is one example of that. And of course, the implication is that when that child goes on to school, they have this, perhaps they're always ready, to react. They're operating out of that. Well, again, is that the sort of the reptilian kind of part of the brain that's fight or flight and ready to react and respond, always scanning the environment and concerned about what might happen, and that child is less able to focus upon the activities in the school setting that place a demand upon the cortex, the actual intellectual learning and things like this. And so one reason why children, perhaps from violent homes and neglectful and abusive homes, have difficulty in schools may relate to something like this. That part of their brain just isn't developed, and their attention is overwhelmed by this particular kind of fear and that goes on in the fearful scanning of the environment that is oftentimes taking place in those children's minds. So many people subjected to serious early life traumas still somehow manage to become high functioning adolescents and adults, and this is where some of those resilience studies come in that we're going to talk about a little bit later on. The children that are resilient and have strengths sometimes can overcome these early life stresses. Feminist theories of relationships, they talk about two different types of feminist theories. One's the psychoanalytic feminists, who really kind of assert and focus upon the gender differences, that is the differences in the kinds of qualities and attributes that are developed in different, the different genders. The boys being more aggressive and forceful and independent. The females being more focused upon caring and sensitivity and intuitiveness and unselfishness and things like that. And these women that grow, that young girls that become women or whatever, become primary caretakers, and they learn to place their focus upon the relatedness and this kind of thing. But boys, on the other hand, really have to focus upon the social pressures of fulfilling male roles. And so when it comes time to, I guess, that Oedipal stage in the psychoanalytic developmental model or whatever, the girls kind of remain attached to females and can continue to develop, their behaviors and their attitudes, kind of modeling after their mother. The boys have to break away from their mothers and attach to the fathers, and that whole deal becomes very complicated. And like somebody once said, this is one of the reasons why boys have such a hard time being understood. They're so complicated psychologically, because they have to make this break from their mom and find a way to attach to their, potentially castrating father. I don't know. I'm not going to get into that, but in any event, there is one theory at least that boys wind up losing what could otherwise become a learned capacity for intimacy and relatedness because of the need to separate psychologically from their moms in that early stage. Gender feminists look at these female ethics and the male ethics that we talked about in the last section, and really believe that we should be valuing female ethics of connectedness as care just as equally in importance as we do to male ethics and things like this. But in patriarchal societies, as I mentioned earlier, those values tend to be seen as somewhat inferior and less important. Social identity theory takes a look at how we identify with certain social groups and begin to identify with the particular groups and develop our qualities and our values based upon the kinds of things the groups tell us are important. And also how we develop a sense of separateness from other groups that are not our own in-group, so to speak. The social identity can provide us with a sense of belonging throughout our life, but at the same time, it excludes other people and can be the basis of prejudice and oppression in our society as well. So it can be a source of inclusion as well as exclusion for individuals. This one theory here suggests that social identity development proceeds through 5 stages, and again, from early childhood into adulthood, and you can kind of see the process, where you're just naively engaged in the group, and you accept it as you begin to understand you're part of a group, but then during adolescence begin to step back from that and perhaps redefine one's identity based upon new groups as one gets older and more independent. And eventually, all of these become internalized, and we become our own individual. Now, I like the quote in the book that says, "For many people, internalization is an ongoing challenge rather than an end state." This whole notion of internalizing and having empathy and those kinds of things. So, a lot of these models, as was suggested earlier, a lot of these models really are not ones that everybody achieves the end stage of, and some of us wind up getting stuck in earlier stages. What about stress? What is stress? So stress is any event in an environment or internal demands that tax the adaptive resources of the individual. Stress can be biological stress, it can be psychological, or it can be social. And I suppose there are other forms of stress as well, but those are three of the big areas we're going to look at. And this one way of looking at stress suggests that there are three categories. One is harm, where there actually has been a damaging event that has occurred already, or a threat where there is a perceived potential for harm that hasn't happened yet, and our in those situations, our defenses are up, and we're guarding against that stress more or less, even if it hasn't happened. That threat, even though it hasn't happened. And another category of stress is a challenge, and this is a positive stress, and it's really seen by the individual as an opportunity rather than an occasion for alarm. So instead of responding defensively, the individual responds with confidence and excitement about the possibilities of things that are to come. That, okay, so what is a crisis then? Well, a crisis is when we reach a situation, a stressful event where our psychological equilibrium is upset, and the old methods that we had for dealing with this particular type of stress or whatever isn't working, or it's an entirely new situation that we've never encountered before, and we haven't really developed methods of adapting to it. So anytime there's harm, threat, or a challenge that we can't cope with effectively, that becomes a crisis. And this will happen a lot of times when we face a serious stress, or when we haven't had any experience in a certain area previously. And again, it can be biological crisis, interpersonal, or environmental. Traumatic stress is a kind of a step up in terms of the seriousness of stress. So when an event occurs that involve actual or threatened severe injury or death of the self or other people, this is considered traumatic stress. And the text identifies as three sources of traumatic stress: natural and technological disasters. This would be things like earthquakes, hurricanes. Technological would be nuclear disasters, not necessarily in war, but say a meltdown of a reactor or something like this. I wonder if cyber disasters, might now also be another source of traumatic stress for some individuals in certain situations. War and related problems is another source of traumatic stress, whether one's lived through a war or has fought in a war, and then individual trauma, and this would include things like abuse and neglect and those kinds of things. So there's also a type of stress that's identified here called compassion stress. I've referred to it more frequently as compassion fatigue, which is something that's important for us in our field. It's this when we deal with victims of trauma, we feel a deep sympathy. We have to engage with the clients experiencing trauma, and to a certain extent, experience some of the stressful feelings associated with that trauma, and this is called compassion fatigue. And professionals who work regularly with trauma survivors wind up encountering this quite a bit, and it's something certainly that social workers are subject to as very definitely. When we talk about in our field about people when they leave the field how they're burned out, burnout is an entirely different thing from compassion fatigue, and it's one of those things that we would do very well to understand, learn the differences of burnout and compassion fatigue, and there are a few other stages that are similar to that aren't exactly either of those other two as well. And in compassion fatigue, it's there are different things to do for an individual who's experiencing compassion stress versus somebody who's been burned out in order to alleviate those issues. We tend to use the biopsychosocial risk and resilience framework for understanding how people experience and manage stress. So that on the one hand, we evaluate the risks that an individual faces, the hazards that occur at the individual or environmental level that increase the likelihood of some sort of harm or impairment, and then those protective mechanisms. What are those things in place that are there that will help to remediate or mediate against any kind of harm that could occur in the environment? These could be personal, familial, community, or institutional resources. And what the impact of these protective mechanisms is that it diminishes the possibility of problems arising from whatever particular stress the individual has to face. Oftentimes, clients' resilience maybe grow from the fact that there have been a number of protective mechanisms that have helped them to cope with the tremendous amount of stress and strain in their situations that other people didn't have. This may be one reason why, for instance, some children can survive violent homes and cope with them more effectively and continue to achieve intellectually, let's say, as compared to others. What were the protective mechanisms that help them develop and make use of their resilience? And the more resilient an individual is, the more that client can understand the strengths that he or she has and put them to use, then the more confident the client will become, the sense that they can be effective in dealing with their world and become a stronger person. And one of the things we can do with clients in crisis situations to help them find their strengths and to connect them with the protective capacities in their environment, and help them make use of all those things so that they can learn how to handle those situations effectively. So, what do we call it when somebody masters the demands of stress? That's called coping. And there are different ways of coping. One way that we cope is by adapting to the situation. Now, there are different forms of coping identified in the textbook. One, biological coping. And this talks about the body's physiological response to a stressor and occurring in three stages: alarm, resistance, and exhaustion. Now, that is that the body becomes aware of the stress, that we become aware of the stress, and the body reacts with an awareness. The body then acts to try to restore homeostasis through a positive response, releasing endorphins and different kinds of cells that are there to help in the fight or flight, perhaps, or to help the immune syndrome fight off physical stresses and things like this. And then the third stage is exhaustion, which is really where coping efforts end because of the inability to sustain. Well, I think actually, yeah, the inability to sustain through the disequilibrium. It should be rather the inability to sustain equilibrium is, I think, what this is supposed to say here. That basically, as these assaults onto the system continue, the cumulative wear and tear of a number of stress episodes and everything like such as that will gradually deplete the body's resources. Why do people get sick when they're in stressful environments? It's one thing to to live through one particular stressful event, but when there's a repeated series of those things, it begins to take its toll physically as well as psychologically on individuals. There is some research suggesting that there's differences between men and women, and in terms of how they respond to stress, and it talks about females' tendency to respond to stress with tend and befriend behavior rather than the fight or flight that is more characterized of males, and this basically suggests that individuals, well, it's the release of oxytocin hormones in the body, which both males and females have, and those hormones tend to encourage calmness and actually, some increased sociability, a tendency to want to reach out to other people, I guess. But that male hormones work against those oxytocins and may reduce its effects, and so this would suggest maybe that females are going to be more effective in stressful situations in many respects. Psychologists, how do they look at coping? Well, one way we look at it is the coping style, and is the coping style a persistent kind of style, or is it something that responds to the environment around it? In other words, is it a trait or is it a state? Some theorists can consider coping ability to be a stable personality characteristic. That's the trait. Defense mechanisms may occur, but they're unconscious, they're automatic, and they work to minimize the threats, and but at the same time reduces our awareness of them. So that's how it becomes kind of a trait. It's just sort of the style of interacting with stressful situations. Now, and you've heard this before. There's a list of defense mechanisms again in this chapter, and I took it out of the slide presentation because we just don't need to keep going over them and over them. But some of those defense mechanisms are healthier than others. And I think as you go through that list, you can figure out which is which. But defense mechanisms in general, are not a bad thing at all. They help us maintain our emotional equilibrium. And again, in this particular model here, those with with the trait of coping well, that would suggest that the defense mechanisms are working effectively. However, coping effectively can be a transient state, and those people believe that this process changes over time, depends a lot upon the context. So strategies change from situation to situation to cope effectively with the situation. How we perceive the threats, the situation in which they occur, all these kinds of things have an impact on whether or not we can apply effective coping mechanisms or not. That's the state theory of coping. Now, we also have different coping styles, and this is something that's useful, I think, in terms of understanding how people respond to stress and maybe what to encourage in them to help them respond more effectively. When you look at coping styles, and really want to look at the first two side by side, the problem focused coping and emotion focused coping. Problem focused coping, generally speaking, is the one that tends to, at least most people would say, have the more positive impact. This is a method that dominates in our thinking when we view situations as controllable by actions. So we focus upon the situation and we act on the environment to change whatever the situation is that's causing the stress. So that's the problem-focused coping method, and it can be very effective. Okay, then the emotion focused coping response style really tends to be one that is used when the situation is beyond our control, basically. And we really can't change the situation or anything, and so we instead focus upon changing our emotions and how we respond to it. We might keep close watch over situations, or we might try to avoid situations, as the slide implies. So there's two different styles for coping. And again, I think problem focused, when the situation is changeable, tends to be the one that's the most productive. But emotion focused coping sometimes may be the only response that some clients see is possible. Now, relational coping is also mentioned, and this really refers to response to stress by acting to maximize the survival of others as well as ourselves. That we kind of move outside of our own being and our own response to stress and look at helping others. And I think, again, kind of a higher level response to coping, as it probably is obvious. Our own culture tends to value the independent functioning self, and so problem focused coping is probably the one that is would be most wholeheartedly endorsed, in our own particular culture. But as this again as the slide implies, that imbalances in power and social forces and oppression, minority oppressions, and things like this affect the coping strategies of individuals. And so sometimes in situations where some individuals may be able to act to change their environment, others can't. And so that's going to also alter the style that they use in coping with stress. Coping with traumatic stress differs from coping with everyday stress in different ways. One of them is that one of the responses in traumatic stress tends to be an emotional numbing, because there's so much less control over the traumatic situation. If not numb, then at least a constricted emotional response. And sometimes the defense mechanism of denial is much more powerful in traumatic stress situations. Confiding in other people becomes very important in cases of traumatic stress. I think just in the ability to process, and someone can listen empathically. Um, this is very important in traumatic stress situations. Coping with traumatic stress takes longer, months or years, and whereas other lesser kinds of stress, is something that coping can occur much more rapidly. And in cases of traumatic stress, there tends to be sort of this life altering kind of transformation in personal identity. At least it happens more frequently than in other kinds of stress. Basically, because it kind of sets up a search for a purpose. Why did this event occur to me, and what does this mean in my life, and what does it mean about me? Those kinds of things. Post traumatic stress, PTSD, set of symptoms that we do run into in our field fairly regularly, experienced by many survivors of traumatic stress, and the symptoms are located here or identified here. The persistent reliving of a traumatic event, avoiding stimuli associated with a traumatic event, having negative alterations in cognitions or mood after the event has occurred, or after you know similar events occur, maybe that kind of that prompt this PTSD symptoms to reoccur, and a persistently high state of arousal, and that can be that constant guardedness and everything like that, or it could be things like sleeplessness or nightmares and those kinds of things as well. These PTSD symptoms often have harsh effects upon relationships, and even in the best of relationships sometimes, and well, working with PTSD client is another, I think, another skill that is something that is worth developing in your field, and also a certain skill set that requires a fair amount of study. Now, trauma informed care has really kind of hit the pages, in social work, I think, and I know, certainly in child welfare, that became a big deal in the last 4 or 5 years. There's been a lot of training about that, as we've begun to recognize in the child protection field that our children in foster care, for instance, we're experiencing effects of trauma that maybe weren't recognized before. Now that's no surprise, I suppose, to think about that. As victims of abuse, that they oftentimes experience PTSD symptoms, in their other relationships and things like this. But sometimes very subtle things can that, for instance, a foster parent might do could increase the harm to the child. One particular case I can remember in a neighboring office. It wasn't our office, but one down the road from us, where a child was in foster care, and the response when a child would be acting out by the foster parents would be perhaps to remove things from that child, toys or different kinds of things like that for a period of time, as a consequence for misbehaviors and things like that. Something that I think is kind of a common response when a child acts out. But this particular child was experiencing loss over and over and over again through several different moves from one foster home to another, having new friendships, and then have those friendships disrupted by another move and still another move, and losing their pet along the way, those kinds of things. And so having things that they valued and appreciated being taken away as a consequence for behavior really kind of exacerbated those PTSD feelings in the child, and created a lot of complications. And it really took some time to step back from what was going on in that child's life and what might be happening in that child's psyche before the foster parents could see that their well-meaning efforts might have actually been, increasing the problems for that child. So it's just an example of the kinds of things that I think make relationships with individuals suffering from PTSD symptoms to be much more complicated than one might think. Sometimes symptoms dissipate very quickly, as this suggests, but other times those symptoms can continue for years and years and years. And they're, like I said, the treatment of this can be very successful. But I think it's the textbook. Yeah, it says here that complete recovery from symptoms occurs in 30% of the cases, so about 1 in 3, and that means that 2 in 3, or even more than that, oftentimes will continue to have one particular kind of problem or another over a period of time. But it's important to understand that in cases, particularly in response to severe trauma, severe stress, I guess is what I'm saying, that it really shouldn't be considered a disorder unless these symptoms persist over time and result in long-term limitations in the person's social functioning. And so a certain amount of these symptoms, are to be expected in response to trauma for some time, but it's only after a long period of time, and the length of time that's appropriate really depends on the individual. There's no prescription for when it should stop, but you have to look at that, and then also in terms of how limiting is it to that person's social functioning to determine whether or not there's a disorder in effect occurring. Social support is those interactions and relationships that give us the assistance that we need, the sense of being attached to other people that we perceive as caring at times when we're in stressful situations in particular, but really at all points of our lives. And 3 types of social support are mentioned here: material support, emotional support, and instrumental support. Doing things for people, having people that are ready to help you out in situations when you need some help getting something done. Now, our network isn't just our social support, but also all those people that we regularly interact with, that that we exchange resources for. So that network might be the corner grocer, for instance. It could be, it might be. People down the street who we see regularly, and that kind of thing. And so our social network is more than just that immediate social support, but other people in the neighborhood and in the community. So why this is important is that sometimes when you're trying to connect people with a support system, you want to look maybe beyond their immediate circle and look at other people that they interact with who might also play a role. Now, they also spend a little bit of time talking about connective technologies. That is, virtual. I think they call it virtual support. The things like Facebook and Twitter and those kinds of things. Those of you who maybe make use of the social media or whatever have discovered that you can connect with people there that you haven't connected with in years, and actually renew some old friendships perhaps, or maintain friendships from a distance. The question, of course, is how does that redefine notions of what a relationship is and what intimacy is and things like this over time? And that's going to be something that those questions will be answered, 100 or 200 years from now, when our progeny look back on this period of time and see how we have changed as a species because of it. But another area for social support that might be considered are those connective technologies, as the textbook refers to them. Here's a list of characteristics of effective support, and I'll just give you a minute to take a look at this. I don't need to read them to you, but I think some key words you see in this list: nurturance, hope, guidance, communication, identity, reassurance, affirmation, rest. Those kinds of things gives you the key of what effective support engages or involves. When we're looking for social support, one of the things you want to do is talk to your client, and if you want to see how effective their social support system is, um, can the client list the number of social network resources out there? Can the client tell you of supportive behaviors of individuals in their lives? And how do they perceive the adequacy of support themselves? These are some ways to evaluate the support system a client has. Now we're going to look a little bit about coping and what's normal and what's not normal. And this this is different depending upon the field or the discipline that you're working from. I suppose, once again, social workers' definition of normal and abnormal are important things to consider, because what we consider to be normal or abnormal has real consequences in the lives of our clients. Um, if we think that something that's going on in life is just kind of, well, that's just the way kids are, it's entirely possible that we are overlooking a serious need that requires more effective interventions, and can lead to problems later on because we didn't act when we could. But by the same token, if we over exaggerate, if we pathologize what might otherwise be considered normal behavior, you know, we can be causing all sorts of other kinds of problems, as this slide implies. So, there, it's important to consider what should be considered normal and abnormal. And of course, again, as I said, the major disciplines we're looking at here define normal very differently from each other. The psychiatric perspective is really a medical perspective that says that things are normal when we are in harmony with ourselves and our environment. And a mental disorder, which is what the psychiatric profession really tends to look at, is a significant abnormality in perceived thinking, behavior, and mood. This uses a disease model of abnormality that focuses on um, the disturbances that underlie the person, inside the person, within the person, the disturbances in their thinking or behavior or mood. And the implication then is that, well, if this is a medical model, a disease model, you got to cure the disease. And since the focus is upon what's going on inside the person, then that means that the abnormal person must experience change from within to be considered normal again. It doesn't really address any issues about the environment, and so while this is a model that as social workers, you're going to find yourself having to interact with individuals in the psychiatric profession very regularly, and sometimes depending upon them, whether for good or not, I don't know, but we oftentimes depend upon psychiatrists in our work. Um, Understand that this is a piece of that client. It isn't who the client is. And once again, I refer you back to the reading on being sane in insane places from this week for more thought-provoking material in regards to that particular question. Now, using this perspective almost always requires us to make use of the DSM diagnosis, as we talked about previously, and we need to understand what that diagnosis is, which is really intended to be a means of one professional communicating with another about a certain set of symptoms that they're seeing in that individual. It is not the definition of the individual. It's very important to keep that distinction in mind. Psychological perspectives on normal and abnormal. What do psychologists say? Well, these, rather than focusing upon the biological and somatic kinds of interventions that psychiatry uses with, medications and those kinds of things, psychological interventions generally emphasize cognitive, behavioral, or reflective interventions as opposed to more of a biological intervention. And psychologists, all the different models we looked at, earlier in this chapter and other chapters, really look at a progression of development through a series of life stages, right? And each new stage of personality development really has built upon a previous stage, and whatever had to have occurred in the previous stage should be completed before the next stage starts. So if there's an unsuccessful transition, and again, there's a number of different models you're looking at here, but if there's complications in the transition from one stage to the next, then this is what's considered to be essentially abnormal in a psychological field. An unsuccessful struggle through one stage implies that the person will experience difficulties in mastering subsequent stages and tasks in those stages. Sociologists tend to look, they really do have an environmental perspective. And one of the things that's, the symbolic interactionists talk about labels and their importance as symbols. Deviance is an abnormal person for a sociologist is a deviant. And when I have taught introductory sociology courses, and I used to try to tell my students, don't think of deviance as a negative thing, just think of it as a state of being outside the norm. And deviance is, however, in our minds tend to be a negative labeling that's assigned when a person is considered to be in violation of a prescribed social order that most everybody else says should be. Now, look at how this is defined. When one is considered by a majority of significant others to be in violation of the prescribed social order, it isn't the act; it's the definition of the act, the perception of the act that makes that act deviant, according to this description. That's an important thing. It's the majority of significant others. So this gets back into the whole notion of subjective reality and how we define reality together. Reality doesn't just exist. By the same token, a deviant act isn't deviant unless a majority of people say it's deviant. I'll give you a good example I love to use in 101. If everybody, at one time or another, we've probably all been exposed to streakers. I don't know, they say streaking occurs at a greater frequency in times of great social stress, So when I was at the university, the Vietnam War was going on, and there would be instances of students, streaking, of course, means running nude through an area, right? Usually having your head, your face obscured somehow, but there'd be instances of streakers running through the dining hall or across a football field or something like that. It wasn't uncommon, and the reaction to that was everybody laughed, and it was, generally speaking, nobody really took it too seriously, and that was that. It was certainly out of the norm. It was maybe a deviant act, but it wasn't considered to be a serious deviant act. What Consider that you're sitting in a classroom at a university and somebody just kind of saunters down the hallway nude and doesn't particularly doesn't try to cover himself up or herself up or whatever. What's going to happen is people are going to phone campus security, or they're going to call the police, and the guy's going to get arrested or the woman will get arrested and taken to court. There, the majority of individuals define that same act as a deviant act, whereas they might not in the other case. So this is an example of how it's not the act; it's our definition of the act. And the group isn't able to grasp the perspective from which the deviant person thinks and acts. It doesn't. The behavior doesn't make sense to us. So in the cases of deviance, we conclude that our inability to understand the other person's perspective is due to that person's shortcoming rather than to our own rigidity of thought or have anything to do with how we label that particular behavior. Another theory that I think is very important from basic sociology, you may remember, I think it was Edwin Sutherland perhaps, had a theory of differential association, and this was used to explain the behaviors of individuals in lower socioeconomic neighborhoods, that were engaging in crime or those kinds of things. And how do young people in lower socioeconomic neighborhoods become drug dealers, for instance, those kinds of things. And what Sutherland proposed was that we learn deviant behavior the same way that we learn compliant behavior. So while the majority of us grow up understanding what's expected of us and have people enforcing and reinforcing pro-social behaviors on our parts, in the cases of a lot of deviant behavior, those young people grow up in neighborhoods that reinforce the antisocial behaviors. In other words, and the consequences for violating social norms are more positive and greater, say, than they are for trying to stick with the straight and narrow. That we learn deviant behavior just like we learn compliant behavior. And so that's Sutherland's idea there. Again, it's something to do with the fact that the group has a lot to do with both encouraging and defining the behavior. Good sociological perspective. Now, social work, we tend not to classify individuals as abnormal. And we tend to look at systems and how one system impacts the person, how the environment affects the person, how the person affects the environment, and on and on and on. Again, that biopsychosocial kind of look at things. The person and environment is a process basically that facilitates or blocks that person's ability to experience satisfactory social functioning. It isn't that the person is abnormal or has a deficit. It is that the interaction between the person and the environment somehow is blocking that individual's ability to experience positive social functioning. Get that? There's a difference there. So one of the techniques that workers will use sometimes called normalization, where we help clients realize that their thoughts and feelings are shared by many other individuals in similar circumstances, so that when a person sometimes feels they're out of the norm or whatever, to help them begin to see that their own feelings and their own reactions to events around them aren't that unique and aren't necessarily that out of the norm at all. So anyway, the authors like the person and environment classification, which is sort of one of the keys to social work education, and it has its own little deficiencies as well. But the person and environment classification system organizes the assessment of an individual coping around 4 factors, and that is social functioning problems, such as their social role, what types of problems do they have in their social roles, and how severe is it, how long has this lasted, those kinds of things. How well can the client cope with the problem? And then we look at environmental problems. What is the social system where each problem is identified? And how does each system interact with the client, whether it be, social services, it could be education system, it could be the economic system, maybe the courts. We look at mental health problems, if any exist. Are there any diagnoses or things like that? Personality disorders identified, that kind of thing. And then finally, physical health problems. What what kind of problems might be identified by a physician, or that is reported by the client that hasn't really been diagnosed yet. So in this model, as the author points out, psychological and pathological problems are accounted for. They're included in the assessment, but they're not given an unusual amount of importance and attention in the overall picture with the client. So really, there is an avoidance here of labeling the client as abnormal. Now, one issue about the person and environment model that's really very interesting is that you know you you that's supposed to say that it offers no way to assess the client's strengths and resources, not a way. So this is the issue here with the PIE model is that there's really no way to assess the client's strengths and resources in it, and that's something that you have to do separately, I suppose, in your work with the client. So, what does this mean for us? I mean, all of this, the last two chapters. Here's some takeaways, I guess, for you to consider. That interventions need to focus on any of several different systems, and in terms of the client, and we should work to help the individual client develop a stronger sense of competence, enhance their problem-solving abilities, strengthen their sense of self, rather, and to recognize the strengths that they have, and also to never to forget to assess the nature and the intensity of the client's interpersonal relationships. Help them to identify their sources of stress and learn about their patterns of coping, and to recognize the possibility that particular vulnerabilities to stress and to environmental conditions give rise to stress. We should help them to assess the effectiveness of their coping strategies, and help them to develop new coping strategies if they need that. Make use of case management activities to develop social supports through linkages with potentially supportive others. My case management instructor, I had a class on case management in my master's training, and he was an old social worker from way back when, and he talked about the importance of systems, and in case managing clients, he felt was really much more important than providing therapeutic services was effective case management. That is, the coordination of all those services and all those resources that exist in a client's life, and that's effective social work. And he very pointedly reminded us to not to forget who he referred to as natural helpers, and those are the people in the neighborhood who everybody turns to when they need a little bit of support or something. It could be an older woman down the street who people like to go and talk to when things are troubling them, or a guy down the block who's real good at fixing things and who likes to help the neighbors when something's broken. Those natural helpers are out there, and we should always make sure that the clients are hooked up with those as well. And also, of course, when working with people in crisis, well, we want to attempt to alleviate the distress and to help them find ways to return to their previous level of functioning. None of that's very surprising to any of us, I'm sure. So that ties up the lecture for both parts of Chapter 4. It's, again, a lot of information in this particular chapter, and I hope that you're able to make use of this in the weeks and months ahead. That's it. Bye for now.